The one huge reason why people fail to heal hip arthritis is that most people spend their time focusing on treatments that are only going to provide short-term relief rather than addressing the root cause and get real, lasting, long-term relief. None of the mainstream treatments out there focus on fixing the root problem, and so as a result of that, they are all short-term. Some are just really short-term, some are medium short-term, and some are long short-term, but they don't solve the root problem and give you real long-term relief. In order to heal a hip joint from osteoarthritis, we need to take pressure off the joint, which can be done by fixing the mechanics around it, and that will allow the cartilage on the surface of the ball and on the inside of the socket to heal. There is no medication that can heal osteoarthritis. It only temporarily takes away the pain. But meanwhile, the cartilage is still being overcompressed because of that root problem, the mechanical problem, and so it can get worse. Pain injections cannot heal osteoarthritis because they're medications that are injected into the joint, and they also just take away the pain temporarily. They don't do anything to heal the cartilage or fix the muscle imbalance, which is the real root problem that's overcompressing the joint. So the joint continues to get compressed, the cartilage continues to get injured, and it doesn't really solve the problem. And other injections like platelet-rich plasma or PRP injections, stem cell injections, and hyaluronic acid gel injections, these are all part of what's called regenerative medicine injections. These injections also do not solve the root problem. They might be buying you some time by possibly getting you some more cartilage cells, but if the mechanical problem is still there, then your poor new cells that have been developed are going to be overcompressed and the problem is going to fester over time. Stretching can improve the mobility of a stiff hip, but only for a short while, and it doesn't improve the strength in the weakest muscles, which is what's needed to fix the mechanical problem. And we know for sure in research that the effects from stretching are only going to last a few hours before you need to stretch again to begin to get another effect. So it doesn't solve the root problem, which allows the joint to continue to be compressed and for the cartilage to become injured. And general exercises like the kind that you get from a healthcare professional who does not specialize in healing hip osteoarthritis naturally, I'm talking about like a doctor of medicine. They are going to specialize in medicines. A surgeon, they're going to specialize in surgery. And physical therapists in general help people recover from surgeries, so they are not specialized in exercise that's specific to healing hip osteoarthritis. So that's why I say general exercise. Oftentimes these healthcare professionals will give you exercises to help you with your hip osteoarthritis, but because their general exercise is not focused on solving the root problem, they might, and they often do, lead into feeding the muscle imbalance, which adds compression to the hip joint, to the cartilage, and worsens hip arthritis over time. And even surgery does not get rid of the problem. Now, surgeons will spin it this way to you. They'll say, well, if I go in there and if I cut out the ball and if I replace the inner lining of the socket with artificial parts, you have an artificial ball and an artificial socket, then theoretically you cannot have hip arthritis and you will never develop hip arthritis again because you no longer have your natural joint. You have replaced artificial parts and they are incapable of developing arthritis. And this is true. However, if the root muscle imbalance is still there, the mechanical problem, that same problem can grow because chances are it's not fixed through the surgery. In fact, it's made worse because of the effects of the surgery. You're going to get those weakest muscles even weaker, and this can lead to problems like knee arthritis, and back arthritis, stenosis, nerve problems like sciatica, and some people even continue to have pain in the replaced hip, which leads to a failed hip replacement. My friends, these treatments that I presented to you, medications, injections for pain, regenerative medicine injections, stretching, general exercise, and surgery, none of these fix the root mechanical problem of hip osteoarthritis. They are all short-term treatments. And because the healthcare industry at large pushes these treatments, that is the one huge reason why hip osteoarthritis is so difficult to heal naturally, because they're only doing short-term treatments. You need to fix the underlying root problem, which is a mechanical problem, a muscle imbalance, so that you can get the joint uncompressed, allow the cartilage to heal, and give yourself a fighting chance at avoiding surgery and not relying on pain medications or injections the rest of your life. And it's very possible to get back to doing the things that you love to do with the people that you love whenever you want. If you want to learn more about my approach to treating hip osteoarthritis naturally, I've got tons of videos here on YouTube that you can check out to learn more. They're in a playlist called the Hip Arthritis Help Playlist. You can find a link to it down in the description below. And even better, I've got a program called the Hip Arthritis Recovery Program. I've got a link to that also in the description below. And that is my entire treatment approach, nicely organized in a step-by-step process that you can follow at home to solve your hip osteoarthritis problem at the root. Hey friends, if this video was helpful for you, please give us a thumbs up. Please share this with somebody you think needs to see this. I know you probably know somebody that's suffering from hip arthritis and doing medications, injections, PRP, stem cells. They're stretching, they're trying to do some exercises, but they're general exercises given by a general healthcare provider. Or maybe they're considering having a hip replacement surgery, and you can make all the difference in the world if you can let them know about this video by sharing it with them. And please don't forget to subscribe to our channel, turn on the notification bell, and make sure to drop a comment below if you have any questions. If you have any comments on if you've improved, we love hearing that. Please let us know if you've improved. We'd love to get back to our comments. And don't forget to check out the free resources that we have available for you for hip arthritis down in the description below. Thanks so much for watching. I'll see you in the next video. Bye-bye.